Welcome to the regular meeting of the Public Health and Safety Committee for May 7th, 2025. My name is Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Wansley is absent. Chair Chavez.
Present.
There are 4 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. There are 2 items on today's consent agenda. Item number 1 is authorizing a memorandum of understanding with Hennepin Healthcare System for the Lake Street Safety Center. And item number 2 is approving appointments to the Community Commission on Police Oversight. Colleagues, do we have any discussions on any of these items? Okay. I'll move approval of items 1 and 2. And with that, colleagues, all those in favor say aye. Aye. Those opposed say nay. Any abstentions? That carries and the consent agenda is approved. Our next item is receiving and filing an overview over the Opioid Settlement Fund Strategic Plan and the city's response to the opioid epidemic. Here to kick off this item is Commissioner of Health, Damone Chaplin. And possibly Deputy Commissioner Ritchie. Welcome.
Good afternoon, Chair Chavez and council members. Let me pull this up real quick. There we go. Okay, good afternoon. Damone Chaplin, Health Commissioner, Minneapolis Health Department. I'm here today with Deputy Commissioner Ritchie. We'll be giving a presentation on the Opioid Settlement Fund strategic planning process. And so this is part 2 of the legislative directive that was issued in 2024. Part 1 of this legislative directive was presented by Deputy Commissioner Ritchie in 2024, which really talked about a needs assessment of staff, funding, and other resources needed to fully implement a comprehensive opioid response program. So today I will be sharing with you part 2 of that legislative directive, which is an overview of the long-term strategy for the use of opioid settlement funds, and then also a comprehensive overview of the city's proposed opioid response led by the Health Department. And so when we think about the opioid settlement funds that we received thus far since 2022, in 2022, these settlement funds are front-loaded. And so in the first couple of years, you receive larger installments, then over a period of time, those installments kind of level out. So in 2022, the city received $2.1 million. In 2023, they received approximately $500,000. In 2024, about $3.2 million. And then in 2025, to date, we've received about $115,000. And so the total expended in 2025 has been about $1 million. And so we have a current fund balance with some encumbrances at about $2.8 million. So in 2021, there was a nationwide settlement which was reached, which resulted in about $56 billion. The state of Minnesota was awarded upwards of $500 million, of which 75% had to be allocated to either county or municipalities to support local response efforts. The city of Minneapolis was set to receive approximately $18 million over 17 years between 2022 and 2038 in regular installments of roughly about $800,000 to $1 million per year. The opioid settlement fund can be used for a variety of different ways to support prevention, treatment, and recovery strategies, as outlined in the Minnesota Memorandum of Agreement. The Health Department elected to develop a strategic plan to inform the use of these funds going forward over the next 3 to 5 years. This process ensured that individuals with lived experiences, residents, community, and government partners and relevant city departments had the opportunity to provide input. And so in 2023, 2024, roughly about $3.5 million were allocated to developing the strategic plan, community-based treatment strategies, including about $150,000 for underserved communities, capital investments in treatment facilities, a mobile medical unit, staffing for various opioid response programs, the purchase of the Narcan vending machine at Station 21, and then $350,000, which was earmarked by Councilmember Osmond for the Elliott Park neighborhood. In 2025, roughly about $1.5 million of the opioid settlement dollars were allocated to staffing for the opioids response initiatives, operation of the mobile medical unit, and then community-based harm reduction, prevention and treatment strategies, including the 150 ongoing expenses for indigenous and the East African communities. Approximately $128,000 for the syringe litter cleanup, which was allocated, and then the second vending machine, which we've purchased, but we have not determined a location for it. It will most likely be over north in Minneapolis. And so when we look at the state and county priorities for Minneapolis as it relates to opioid settlement dollars, we can see for 2024 and 2025 that approximately 38 grants totaling about $8 million were distributed from Hennepin County. Those areas of investment were primarily in harm reduction and the treatment area. And then when we look also at the state funding for 2024 for Minneapolis, we look at a total of 8 grants totaling about $5 million, with the bulk of those resources going towards prevention and recovery. And so when we look at a summary of the state and county opioid priorities, we can see here for prevention, we're at about $3.7 million for both state and county. For Minneapolis, $3.6 million in harm reduction for state and county, $4 million for treatment, about $1.6 million for recovery, totaling about $13 million for 24-25 from both state and county for Minneapolis. And so when we look at the strategic engagement framework that was used to develop the strategic plan, we see a summary of the primary stakeholder engagement strategies, as well as the organizations and groups that were engaged. Through that process, we developed and distributed community surveys, focus groups, engaged with focus groups with lived experiences. We interviewed focus groups with providers and partners, and then also governmental partners and advisory groups as well. And you can see the list of folks who were part of those engagement groups. And so ongoing efforts, it's a brief summary of the key strategies pursued in previous years, providing a network of syringe disposal units to support syringe litter mitigation within the city, contracted with the community partners to provide ongoing education on the administration and distribution of naloxone, implementing a hospital-based MOUD pilot program, which we call the First Step program, establishing ongoing relationships with community partners to develop a concerted strategy, contracting with community partners to implement prevention programs with communities impacted by the epidemic, and then collaborating with internal and external partners to expand access to MOUD and other treatment options. And we look at the current and emerging priorities that we have, that we've been engaged with. The items below are not meant to represent everything that's been done, but simply highlight some emerging efforts. As mentioned before, the mobile medical unit, we're hoping to have that up and running sometime around the middle of July this year. The Narcan vending machine expansion, which we have purchased. The safe recovery sites research. The contract negotiations for that is in progress, and so we should have someone hired and starting that process relatively soon. And then the First Step expansion program, which is actually pretty exciting, it's taking that hospital model and expanding it out to the Elliott Park neighborhood with the support from HUMAN, the Native American Community Clinic, the Riverside Emergency Department, mHealth Fairview. And then some of the prevention strategies that we are working on are through the school-based clinics collaboration, which is the Narcan training, and then also the neuroscience health curriculum, which is the the science of the brain. So some of the final goals and strategies that came out of the strategic planning process was to enhance our prevention and recovery support for the community, support access to evidence-based, culturally specific treatment. This was a new one, improve coordination and alignment between state, county, and local government agencies operating opioid settlement funds, and then opportunities for ongoing community engagement. So we look at the goals and strategies for Strategy A, the enhanced prevention and recovery. These are some examples of potential programs that we will be lifting up when you look in the middle column that we'll be exploring for opportunities going forward around prevention and recovery support. When we look at Goal B, which is support access to evidence-based culturally specific treatment. We have some programs that we have already been working on and we're looking to explore further, which is our MOUD program, traditional ceremonies, programs for our Somali community practices and African American community practices, mothering from the inside out, celebrating families, the First Step program, which we will be expanding, and then the mobile medical services. Those are some of the examples of evidence-based practices that we'll be using for item B. And then for item C, improving coordination and alignment, we've already begun having those meetings with the county and state, and we've probably had 3 meetings to date. Those meetings are supported by health department funds with the outside independent contractor who's helping to facilitate those conversations. Those are going very well. We are really beginning to use common language, common definitions, and looking for opportunities for us to collaborate even deeper. The city as a convener, we've been convening those meetings. Those will most likely continue throughout the summer, with the city being the backbone organization for that collective impact model. Quarterly provider meetings, we're also engaging with our FQHCs. They've also been impacted from the federal cuts that have happened across the country, and so we're working with them to see how we can deepen those collaborations and relationships to further some of our own initiatives and collaborate with them on some of their initiatives. And then transparent communication on grant opportunities and awards. One of the things that we found throughout this strategic planning process is that we have in some situations, we have 3 different agencies funding the same organization for the same effort. And so there's an opportunity there for us to diversify some of those funding streams and strategies. And then the last one is the ongoing community engagement. Through these efforts, we will figure out the best strategies for engaging with community. We have a couple of ideas. The health department has had a couple of ideas of how do we do that. But it's, after these meetings with the county and state, it's very obvious to us that it's much better when we work together and we develop those strategies together. So we're in the process of doing that now. And lastly, action steps. Future year funding priorities will continue to be identified through the intergovernmental collaboration process. regular engagement with community-based providers, and ongoing community engagement efforts. Creating the structures and processes for this ongoing collaboration and engagement will be among the first tasks of the Health Department, which we've already begun. And then we've already begun to establish regular meetings, establish a regular cadence of provider-partner update meetings, establish a plan and process for ongoing community engagement, and then lastly, establish a funding strategy for designated programs and services. So that concludes my presentation, and I'm available for questions.
Thank you so much. And I'd like to recognize that we've been joined by Vice Chair Wansley. Yeah, I have a few questions, Commissioner. Thanks for the presentation. A little bit about the general funds for syringe litter cleanup. I forgot what slide that was, but do you have an update on that? I assume it's, the slide said it's $127,000, around that much.
Yeah.
And I'm assuming it's split between the funding for needle cleanup. Are you including the public health specialist position in that?
Yes.
Do you have an update on?
I think it's been posted, and then the
Perfect.
posting has been closed. Is the posting closed?
Close.
Yep.
Cool.
Posted and closed.
So posted, closed. I'm assuming interviews beginning soon.
Yep.
And then, okay, that's exciting. Thank you. The second component of my question was there was a community survey that you mentioned in the slides with around 250 responses. Do you have a quick overview that you can share of what was in that survey? Like, what did people, the providers, I'm assuming is who, and community members that were taking this survey, like, what were some general themes of that?
Yeah, the general themes were included in this presentation.
Okay, that's what it, okay.
Yeah, it was included in here. Ideally, they want more transparency. They want opportunities to engage. They want to be closer to the decision process. And so that kind of came out of that, and making sure that we have the voices of folks with lived experiences.
Perfect. I think if you can maybe possibly have a council follow-up with more in-depth of like that survey, I think that would be helpful for us to understand.
Sure.
Cool. Administrative follow-up would be just a more in-depth analysis, I would say, on the survey that was conducted by staff. Thank you. That would be super great. And then my last question, really excited about the Safe Recovery Site research component. I think on the side it said there is contract negotiations in progress. Can you remind us and the public when the goal is to have that research done and presented, I'm assuming, to the City Council?
Chair Chavez, I'm going to have Deputy Commissioner Heidi respond to that one.
Good afternoon, Deputy Commissioner Heidi Ritchie for the Health Department, through the chair. So we are going through the contract negotiation process. So we selected someone and we're going through that. Keep in mind, we're also working with Ramsey County on this. So we're going to get this sort of study and analysis. And then the second part of that will be the kind of engagement around this issue. And so I'm not exactly sure on a timeline right now for that, since really that's going to depend on when we're able to finalize that contract. But I can definitely keep you posted.
Yes, please. That is that would be really helpful. And again, I really appreciate the work done with that and look forward to learning more in the future. So those are all the questions that I had. Thank you for the presentation. Next up, we have Vice Chair Wansley.
Thank you, Chair Chavez. Also, sorry, losing my voice. Thank you, Commissioner Chaplin, for giving this presentation. I know my office, along with Vice Chair Chavez, have worked with public health leadership in the span of several months to get this legislative directive fulfilled that I believe I and Council President Payne initially authored. And I do want to ask if, following up with the clerks, just seeing supporting documents, that part is missing in terms of like the legislative directive, and if we can get that added. Because I was looking for it just to make sure there was correlation. But that said, this has been something I know we've heard from our constituents a number of times, of just seeing how the city is being responsive to the opioid crisis that is being manifested in a variety of ways. And I think we've had a number of conversations amongst here, and many of the experts you've brought before us to talk about this, of seeing it particularly impacting our young folks of color. And again, like, what are we doing as a city to be responsive to what's becoming a growing crisis and has been an existing crisis? So really excited to finally get some more of a baked out plan around how you all are using these resources via the opioid settlement funds, and then also what are some of the concrete strategies that you've already put in place and that you're looking to implement further. And the first question I did have was going back to slide 11, was just getting clarity on I couldn't, well, again, clarity, but it sounds like in the process of overviewing all of the activities that you all have been doing, or in conversations with community partners, you mentioned these are either current or emerging priorities. Just wanted to get a sense of if their emerging priorities were for sure going to be baked into the finalized goals and strategies that you then lay out on slides 12, 13, and 14. But I know they're also more exhaustively listed in the actual report that you attached.
So the idea is, Chair Chavez, Councilwoman Wansley, the idea is for us to really, the power is really working with the government partners to understand where the gaps are, and then listening to community where those gaps are, and then trying to fill in those particular gaps over a period of time. And so what we're hearing, both from the strategic planning process, from the engagement, and then from the partners as well, is that we really don't have, I am, myself, really getting an understanding of how the county system works. And so how does that really work in supporting Minneapolis residents? And then where are the sweet spots where, as a health department, we can really engage, we can really be strong. And so right now, we're looking at prevention and recovery as the two spaces where we can kind of have the best overlap. That strategy right now is getting into schools, engaging with young folks and telling them about the harms and potential harms related to substance misuse. And then the recovery piece, the hope is that when we get this medical mobile unit up and running, and if we're able to, and our goal is to get the Brixadi on the medical mobile unit, if possible, we can get treatment into the community, right into the community. We can drive it into the community, which gives them an opportunity for getting long-term recovery, getting into long-term recovery. And so those are the two strategies right now that we're looking at to really kind of push forward. And so some of those programs are already working. We've had Deputy Commissioner Ritchie and her team has already put some of the ground pieces in place. We have folks hired. We're working on the operational plan for the MMU, and those programs for the school either have begun or will be beginning relatively soon. So we are pushing forward with the strategies that have been recommended thus far.
Okay. And I'm seeing here, I'm just also trying to cross-relate with the report to where you lay out, because I was going to say some of that wasn't added in the slide, but you do list out the recommended time period for some of the proposed strategies in the report. So looking at that too, and thank you so much for also including the proposed funding amounts with those too, and thinking of as we're walking into a new budget season, like things we should be looking ahead, as you all might be proposing some of these things, or also as you're having conversations with our partners and you're talking about gaps, maybe they might be willing to pick up some of these components. But just seeing like not all of these things are included in the 2025 to 2026 strategies. This was just given as like a synopsis. And I'm just going off of page 47 of the report, but that's good to know. And then I'm glad Chair Chavez brought up the safe recovery site, because that was also something that I heard also lots of feedback around in terms of where is the progress on that. If we're still seeing alignment with the states around supporting that effort, and it sounds like there is, which is great. And then going to, there was a question I had related to slide 16. Also clarity on these. So initially you mentioned these were done, but they do have to be determined kind of emphasize with 3 out of the 4, so just wanted to get a sense of like, are these in action? Because in the first one, you mentioned they're completed like this in terms of establishing a meeting, a regular meeting with these particular partners in item number 1, but then it sounded, as you were discussing, as if those things had also been completed for items 2, 3, and 4, but it said to be determined. So are those things still being figured out?
Yeah, we have regular cadence with the state and county. We are setting up regular cadence with the FQHCs. We have been meeting with them. We've had probably 3 or 4 meetings with them, but they've been kind of ad hoc meetings with the collective body of the FQHCs. And so that's scheduled to be more solidified going forward. And so we have one big meeting coming up. It's planning to be sometime in the summer. And so we'll have that meeting set up, and that will set off a set of other cadences for meetings. So those 2 things have already been set up. We're set up for meetings right now. I think we're set up through September for meetings with the state and county. And then in the next couple of months, maybe a month or so, we'll figure out how we're going to be working with the FQHCs.
Okay. And then with the county, I'm assuming there's some overlap, like for item 4, with establishing a funding strategy, or is that for internal, or is that to also bring in the partners too? Because just thinking of some of the discussions or outcomes that happens at the state, we already know it's a mess nationally, but depending on if some funding is not, or funding measures aren't passed at the state level, that many of the providers who do harm reduction or support residents with this particular area, there's going to be concerns around their sustainability. So just thinking through if kind of urgency around setting up this meeting, or if this was just internally something you all were going to be figuring out for like the city side of funding.
No, the financial piece was, we actually get to have all the pain points in the room at the same time. And so that's super helpful because we can all talk about what's happening, what's going to happen from a financial perspective. Realistically, what we were talking about was we wanted to make sure that the funding was dispersed evenly across the community. And so we wanted to make sure that we weren't overspending or over budgeting in one area with one organization, not knowing it. There are some situations where, one organization is receiving the same funding from 3 different government agencies, and that's not the most efficient way of getting services out. And so we want to be able to identify those situations through these collective impact models. And so when we get everyone in the room, we can foresight, we can see what's happening down the road, we can talk about what's happening now, and we can learn from what happened in the past. And so it really is super helpful.
Awesome. Those are all the questions I had, Chair Chavez. Thank you.
Thank you. And next up we have Councilmember Rainville.
Thank you, Chair. I just a couple quick questions. Commissioner, thank you for this great presentation. It's very helpful. But do you anticipate any results of lower drugs being brought into our community with the recent border control issues?
Those are conversations that we would have through our collective conversations with the county and state or with law enforcement, but we haven't heard anything yet.
So right now the supply is steady?
Far as I know, nothing has changed since a year ago when we did this strategic plan.
Okay, great. And then could you just speak a little bit more about the mobile medical unit? That seems to be a very proactive way to help people. Would like to dig a little deeper on that.
Yeah, Chair Chavez, Councilmember Rainville, if you don't mind, I'll invite Deputy Chris Ritchie to talk about that.
Thank you for the question, Councilmember Rainville, through the chair. We actually have our nurses in the audience right now, so say hi. And then our driver also, Tony, so he's part of our opioid response team, and he also took our commercial driver's license test, and so he's our driver. And then, of course, we have Suzanne, who's the manager of the opioid response team. And so they're in the audience and could probably answer that question better than I, but what we're really working on is focusing on getting our mobile medical unit license. So we have to get that license, and then we will be able to plan out like the locations that we'll be able to go to. So in order to get that license, we have to provide a list of locations, not like specific, but we are working on that. Also, we're going to be working with vaccinations. We're working with our school-based clinics to see where we can help there. But the main focus really is to make sure that we can get health care access to people that don't have traditional health care access. And so we'll be going to community events. We'll be partnering with, places like the Native American Community Clinic. The commissioner mentioned FQHCs, federally qualified healthcare centers. So we've been talking with the Minnesota Association of FQHCs so that we can make sure that we're working with them on a referral process, because this is not a primary care unit, and we want to make sure that when we see people, we can then help refer them into primary care. And so we're working on those relationships with other community providers so that we can make sure that there's continuity of care from when we're able to see someone, and then they can go on and get that, have that provider that they can see for all their other items. We'll have wound care, we have a dental chair, there's a ADA lift, so we can make sure that it's as accessible as possible. And then also, our nurses have been working with the homeless response team to sort of help when there might be issues that are beyond the HRT and they're more of a health-related nature. So I hope that answers your question. If there's any more specifics that I can provide later, I would be happy to do that.
No, that's great, and I just want to welcome the team there, so thanks for coming down today. I wish you the best of luck. Just let us know. We're all supportive of you, so we want to help you succeed. This is a great plan, so thank you.
And I think that is all the questions. Thank you so much for the presentation, Commissioner and Deputy Commissioner. We really appreciate it.
Thank you, Chair Chavez.
All right, so seeing no further questions, I'll direct the clerk to receive and file that update. Our final item is receiving and filing a report on the pollution control annual registration, also known as PCAR fee for carbon dioxide equivalents. Here to kick off that item is Jenny Lansing, the Senior Environmental Project Manager. Welcome.
Chair Chavez, council members, my name is Jenny Lansing. I'm the Senior Environmental Project Manager in the Health Department, and I'm here today to present to you the Pollution Control Annual Registration Carbon Dioxide Fee Update. This fee update is the result of a legislative directive. The legislative directive reads, a fee study of the pollution control annual registration fee for carbon dioxide equivalents to reflect updated expense and revenue estimates. The fee studies should be based on a 95% recovery ratio and align with all relevant financial policies. So in February, the Health Department signed a contract with Braun Intertech to conduct a PCAR CO2e fee study that will inform the cost of mitigation for carbon dioxide. At the same time that this work began, Health met with the Budget Office to discuss what is legally allowed for 2025 cost recovery. The cost recovery for 2025 will include the cost of the contract with Braun and the cost of hiring an industrial outreach specialist who will begin in the fall. Because we are just beginning to stand up the CO2 industrial pollution reduction program, there are no mitigation expenses in 2025 to be included in the cost recovery. So this table here shows how we arrived at the 2025 fee determination for the PCAR CO2 fee. You can see at the top the expense categories, which include the contract with Braun Intertech for $98,000. The personnel expenses is the cost of the industrial outreach specialist that will begin in the fall. That's just under $50,000 for a total of $147,872. The input into that is the tons of carbon dioxide equivalent for which this fee will be applied in 2025, and that amount is 3,210 tons. At a 95% recovery rate, that calculates out to an expense of $44 per ton of carbon dioxide equivalent. Now I'll give a quick update on the work of the Braun fee study. Braun Intertech is working on the fee study that will determine the 2026 fee for carbon dioxide. Their work has been divided into 2 phases and 4 separate task categories. Reviewing and updating the annual carbon dioxide emissions. Braun Intertech reviewed all of the emissions data that are associated with the initial 36 facilities. They divided them out into categories associated with the type of fuel, so either liquid fuel, which is diesel and gasoline, or gaseous fuel, which is natural gas and propane. They reviewed all of the air permits for these 36 facilities in order to identify each facility's equipment that they're using liquid fuel for. They then determined that the most common diesel-using equipment at these facilities are boilers and emergency generators. In task 2, they identified potential carbon footprint reduction projects based on feasibility, economic viability, and environmental impacts. These projects are primarily focusing on alternatives to diesel-fired equipment. In task 3, Braun has developed a framework to calculate potential carbon dioxide reductions over the next 3 to 5 years. They're currently working with multiple vendors to obtain cost information for these alternatives. This information has been presented before, but just a reminder about those initial 36 facilities that were included in the Braun fee study. These are large facilities that have an air emissions permit in the state of Minnesota. When they have an air emissions permit, they're required to report the amount of combustible fuel they use. And based on the amount and type of fuel, the Minnesota Pollution Control Agency calculates their greenhouse gas emissions. So these are facilities, these 36 facilities are facilities that are using combustion fuels that are outside of fuel covered by the franchise fee. And as I mentioned before, we're mostly focused on boilers and emergency generators. The types of projects being evaluated by Braun right now are primarily focused on alternatives to the diesel-fired equipment. The projects being evaluated include alternative fuels, batteries, and replacing older equipment with newer and more efficient equipment. And looking ahead to the 2026 CO2 PCAR fee, the work will continue in 2025 to establish the program to mitigate carbon dioxide from these industrial sources. Health will give a presentation on the PCAR CO2 fee study in August of 2025, which will include the cost of mitigation, and that will be in coordination with the annual license fee update process. And this is the fee that will then be applied on January 1st of 2026. And that ends my presentation for today, and I can stand for questions.
Thank you for the presentation. I'll first pass it to Vice Chair Wansley.
Thank you, Chair Chavez. Sorry, let me move the mic back. Okay. I did have a couple questions. Also, thank you for bringing this presentation forward. It's been a minute for us to finally get it. And I know this is something that residents have been really excited about in terms of seeing the city continue to move on this work around carbon emission reductions, and knowing that it's not only a high priority for them, but that's also reflected in the climate equity plan that council passed last year, which set several robust goals around how we can become a carbon-free or carbon-neutral city within the next 10 years, we're already in that phase. But of course, implementing PCAR fees on carbon dioxide was identified as a strategy. So really excited to have been part of this work for over 3 years of working with staff to figure out how we can implement this and doing extensive oversight in order for us to get to this point where we will actually be reducing carbon emissions, hopefully starting this July of this year. And I would say, based off of my experience, I think because of that dedicated council oversight, we would not have gotten to this part. So I also want to say thank you to my colleagues who also have supported this work. But that said, I am also glad to hear that staff is going to be doing a contract with the external consultant named Braun in order to create a successful program going into 2026, of course, with the goal of doing carbon emissions reduction work and to make sure that polluters, of course, are paying for that work instead of seeing that be passed on to taxpayers. And I think that is something that's really something we have to consider around how we're funding our climate resiliency work, especially under the national climate. But that said, I do have an email from March 2023 where I know health leadership at that time noted that they were consulting with another contractor called Elevate to do, it seemed like, somewhat similar work, but I don't think there was ever a report shared, or definitely not in the LIMS file, from the outcomes or the findings from that. So I did want to see if staff or you all could upload the findings from that consultant report from Elevate, because I think there might be some overlap, or if Braun will be taking into consideration some of the findings that was also made in that previous contracted consultant report.
Chair Chavez and Councilmember Wansley, I didn't work directly on that report, but I can definitely check back and make sure that any reports that are available are uploaded to LIMS.
Awesome. And I'll make sure to work with the clerks to make sure you receive that email, and that is also forwarded to LIMS so that everyone is on the same page. Also, just going to your last slide around just next steps too, just making sure that there's a smooth procedural process going forward that's clear for everyone. I do know with the PCAR ordinance for 2025, we did set an implementation date for July 1st. That was based on the joint staff report that was co-developed with our Policy and Research Division and the Health Department that was presented to us last year. Now that you all are presenting a different number, just wanting to get clarity on how you all are planning to approach the procedural next steps in order to address that 2025 fee schedule.
Yes, Chair Chavez and Councilmember Wansley, we are moving forward with the 2025 fee so that it is on time and ready to be billed out on July 1st. So we are updating the ordinance. We'll be back before the Business Committee to update that fee. We are prepared to enter the fee by the May 15th deadline into ELMS, which is the deadline for us to enter it into the system in order for the billing to be able to go out by July 1st.
Okay. Awesome. And then wanted to get clarity too on just the presentation piece. I'm going to slide number 3. I did want to get clarity on the industrial outreach specialist. I'm thinking of the cost, because I know in that joint staff report, one thing that the FTE is charged with doing is also supporting the mitigation efforts with the polluters that are going to be assessed these fees. So will this FTE also be doing that, but just for a shorter period of time from September through the end of the year?
Yeah, Chair Chavez, Councilmember Wansley, that's correct. That's why you see a lesser amount here, because we're with an anticipated start date of September 1st. It's the estimated cost of that position just for the remainder of 2025.
Okay, great. And then going to slide 4, I did want to get a little bit more clarity of how the CO2 amount or input amount was assessed. Also considering since the Braun study will be doing that updating and reviewing of the CO2 or carbon dioxide figures. So just wanted to get a sense of, yes, how this was assessed.
Yeah, thank you, Chair Chavez and Councilmember Wansley. This number, the 3,210 tons, this is the amount from the emissions data from the year 2022. So the Minnesota Pollution Control Agency, their emissions data, after it goes through all of the final review processes and becomes finalized, is about 2 years behind where we're at. So when we build on January 1st, for the rest of the PCAR fees, we were using emissions data from 2022. So because this is still 2025, we will also be using the 2022 emissions data. This amount, as I mentioned, it's all of the facilities in the city of Minneapolis that hold an air emissions permit that then are required to report their combustible fuel use, for which greenhouse gas emissions are calculated, but their combustible fuel use does not include fuels that are covered under the franchise fee. This number is always a bit of a moving target because year to year, the emissions change. Sometimes facilities close. It's possible that new facilities will open. Some years there's higher emissions than others. For example, the year 2021, there were some weather events that created very high emissions in this category. So if you were looking back at the 2021 data, you would see much higher emissions amount. But this, takes into account all of the facilities and all of the tons of CO2 that are eligible for this fee.
Okay, and this is inclusive of the 36 that's already on the PCAR, well, on the registry then?
That's correct. It might be a little bit different because some of those facilities have since closed.
Oh.
And so they would not be able to be billed.
Do we know right off the bat how many of those 36 have closed since?
Chair Chavez and Councilmember Wansley, I believe that 3 have closed in the past year, Smith Foundry, Bituminous Roadways, and Prospect Foundry.
Okay, all right, it's good to know. Yeah, those are the questions that I had. Thank you.
Next up, we have Councilmember Palmisano.
Thank you, Mr. Chair. Thank you for this presentation. Of course, my first question was one that Councilmember Wansley asked about when this will be applied. It will be ready for July 1st, and that's great. The reason that the staff component is only about $50,000, is that because it's a partial year?
Chair Chavez, Councilmember Palmisano, that is correct. We anticipate the hiring of this industrial outreach specialist. We anticipate they're going to begin around September 1st.
And so then we can assume that in 2026, that staff position requirement will be much bigger because it'll be a full year. Got it. And that won't be offset by less study from a contractor? Will we still need to do study from Braun or somebody else?
Chair Chavez and Councilmember Palmisano, the fee study will conclude in 2025, so there are no anticipated costs for a fee study in the year 2026.
I see. So then what mitigation fees do you anticipate in 2026, like in total? Do we know yet?
Chair Chavez and Councilmember Palmisano, we do not have a dollar amount ready yet.
Sure.
If that's what you're asking.
Yeah, that's what I meant.
Yeah, we will in August, though.
All right. Thank you.
Thank you. And next up, we have Councilmember Rainville.
Thank you. So excellent presentation, and I do have a question, but first I see the manager, Kelly Millman, in the audience, and I want to thank you for always having your staff available when we have issues. So whether it's odors, noise, you've been great, you and your staff, so thank you. The question I do have on this presentation is you had talked about diesel use and how tricky that was to monitor. Is that because it's usually used in the colder weather to supplement heat?
Chair Chavez, Councilmember Rainville. It depends. Diesel use can be used in boilers and emergency generators. So it's a little bit different for every facility, which is why this fee study gets really complex. It's a lot of digging into each individual facility and the equipment they're using, the fuels they're using in those pieces of equipment, and how and why and when they're using that fuel. But yes, so for example, in 2021, diesel was in higher use, in particular from the energy generators in the city of Minneapolis because of some weather events that required them to move to the backup generators for electricity generation. And as such, they were then burning more diesel fuel.
Great, thank you very much.
Amazing, and we have no one else left on queue. Thanks so much to you and staff's work on this. We really appreciate it. All right, colleagues, seeing that there is no further discussion on this item, I'll direct the clerk to receive and file that report. And seeing no further business before us, I will declare this meeting adjourned.